Hi friends, I am Dr. Anil Bhoraskar, Diabetologist, SL Raheja Fortis Hospital. Today I am here to discuss few things about acute problems in type 2 diabetes. Diabetes, is a disease of multiple complications. There are chronic complications and acute complications. And there are acute complications of chronic complications. Today I am going to discuss problems related to diabetes acute complications which are seen predominantly in insulin-dependent diabetic. There are, as you know, two types of diabetes, non-insulin-dependent diabetic and insulin-dependent diabetics. Formerly they were called as type 1 and type 2. But predominantly we see type 2 diabetes, but they also need insulin. And people who take insulin regularly, they face a lot of problems. And one of the major problems which brings the patient to the hospital emergencies and bring them to other departments like cardiology, ICU, is a hypoglycemia. Hypoglycemia is a sugar going low. Normally the blood sugar is between 120 to 180. When you try to manage diabetes too tightly and you all been told that you have to maintain the HbA1c, which is a yardstick of control of diabetes, less than 7 or 6.5. While trying to do that, you always overstep and there are chances that your sugar may drop dangerously low. Try to remember one thing, that sugars, when it goes below a certain level, it gives you some warning signals. In particularly people who are recently treated on insulin, they do have the warning signals because their sympathetic nervous system is quite active and gives you protective symptoms such as tingling and numbness, yawning, headaches, blurring of the vision, and they help themselves to some sugar or they are in state of consciousness to help themselves and prevent the further damage. But as the disease progresses over a period of time, these warning signals of a low sugars are blunted and people go into a state where the sympathetic nervous system is not very active. They go into a system of a neuroglucopenia, that means the blood sugar in the brain going low, and develop sensory system derangement such as drowsiness, stupor, and sometimes coma, which is a dangerous thing. People can hurt themselves, people can certainly develop cardiac abnormalities, particularly atrial fibrillation. As you know, the diabetics are vulnerable to get cardiac disease very often, and particularly the rhythm disturbances. They are precipitated by hypoglycemia, and that is what sometimes brings the patient in a state of maybe sometimes cardiogenic shock or can develop complication related to the nervous system, which can look exactly like stroke. Many times stroke-like symptoms are seen in hypoglycemia. You may have aphasia, difficulty in speaking, dysarthria, or people talk as if they are under stupor or they are alcoholic. Many times hypoglycemics are found by the police people as drunkard and they are put in the locker saying that he is intoxicated. So symptoms like intoxication due to alcohol is also identical in hypoglycemia. So this is a potentially serious condition. You must know that this is a completely preventable condition. How do you prevent it? And therefore you must know what causes this hypoglycemia. First is a erroneously wrong dose of insulin. Second thing, a lot of people forget whether they have taken the insulin in the morning or not, or they have taken a tablet in the morning or not. My principle and my dictum to the patient is that if you have forgotten that whether you have taken injection or tablet, then you please don't take it. It is better to skip one day injection or tablet than to take a double dose. So that's a common mistake. Second thing, people undertake exertion which is not their usual pattern. unaccustomed exercise. Sometimes it is done particularly when the people go for walks and they feel a lot of young people walking way past them and they try to chase these young people, and that is why they do exercise or exertion which they are not used to. Or sometimes people overdo things, even household jobs. They say, "No, my maid servant has not come, let me finish all the ironing and all." They don't know how much calories they have consumed during this unaccustomed exercise, and that's the second cause of hypoglycemia. And the third cause, of course, in early renal disease, the insulin life in every patient goes up, as a result of which the same dose of insulin starts producing low sugar. When the patient complains that, "Look here, most of my sugars are on a lower side," don't pat your back or the patient's back. Do his complete renal functions. Early nephropathy, early rising creatinine, where the patient does not have edema feet or breathlessness or symptoms which are related to water retention. But early kidney disease can also prolong the life of insulin or a tablet. The same tablet which was causing a blood sugar of 150 to 200 suddenly starts producing blood sugar of 120, 90, and that is why you have to adjust the dose, particularly sulfonylurea, which are very potent hypoglycemic agents. You have to reduce the dose. That is the second step that you have to do. Take a periodic checkup on your creatinine and renal functions. And a third thing, avoid prolonged fasting. There are a lot of talk about intermittent fasting, and there are a lot of fasts which are done on religious region, that they starve certain days, they don't eat 24 hours, which is not right for diabetics, particularly if you are taking sulfonylurea or other newer generation drugs or insulin. You should try to stay away from prolonged fasting. Now, fourth thing, in travel. Please remember, in city like Bombay, if you leave your house in Borivali and you're going to have your lunch in Nariman Point at your lunchtime, and your lunchtime is fixed at 1 o'clock, you can be sure that because of traffic jams, you can reach your office late and you have your lunch at 3:34. So always carry some snacks and sugar packets in you with yourself in the car or wherever you're traveling. Carry some carbohydrates with you, and the best policy is to carry short-acting carbohydrates. Now please remember, whenever you feel hypoglycemic, don't take chocolates, don't take mithai, because it takes 2 to 3 hours to act, and you take the blood sugar, at that time is 100, but the blood sugar goes up to 200 after 4 hours. What prompts up sugar quickly is plain sugar, simple sugar dissolved in glass of water and drunk immediately, is like a high efficiency fuel. Keep sugar packets with you all the time. In case of emergency, take sugar diluted in water and avoid taking chocolate. A lot of people feel like eating chocolates, that's a different thing. But the point is, chocolate will not immediately bring up the sugar. So keep that thing in mind, and that's the only way you can prevent hypoglycemia. The second complication is exactly reverse of hypoglycemia, which is known as non-ketotic hyperosmolar coma. That is severe state of dehydration where the patients are usually elderly. The blood sugar keeps on rising, which is a hyperglycemia of 600, 650 sugar. Usually these are the elderly people sitting alone at home. They neglect the signal of thirst. They don't drink water, and there is a state of extreme dehydration because the blood sugar is just like a syrup. The blood sugar goes to 600 and it causes what is known as hyperosmolar state. The flow of the blood is impaired because it is thick blood as a result of its high level sugar, and this is known as hyperosmolar state, usually seen in elderly, people who have not taken their shot of insulin, people who have forgotten to take a right dose of insulin, or the insulin is kept outside the refrigerator and not maintained a cool temperature. The same dose of insulin has not acted, the blood sugar keeps on rising, to 400, 500 and 600. So frequent monitoring of blood sugar is also a key to prevent this complication. You must check your blood sugar on a home glucose monitoring system at least once or twice a day to see what is the level of sugar. And the third acute metabolic complication, which is known as diabetic ketoacidosis, which is usually seen in type 1 diabetic, usually seen in children. The diagnosis is so certain, obtunded sensorium, the patient is listless, morose, the patient has got a fruity odor in the room. As soon as you enter the room of the patient, because the ketones which are released, they give you a fruity odor in the room. There is extreme dehydration and there is a acidosis. Ketone production is like a car which is out of tune. When the carburetor just does not function, fuel gradually inside the engine, instead of the car moving, the fuel is converted into smoke. Similarly, the body produces smoke, which is ketone, which is highly toxic and can produce variety of complications, and one of them is acidosis. The blood pH, which is a measure of acid-base balance, is less than 7.3. The patient is highly acidotic. Patient tries to do it, but the body has a mechanism to get rid of this by hyperventilation. You breathe rapidly, like that you do, so you wash off the carbon dioxide and water so that the acidosis is tried to be minimized. But the bicarbonates is the line of treatment, and the treatment is hydration. Either hydrate the patient. Patient may have vomiting. One of the reasons why you can have omission of insulin, dehydration, severe vomiting, or most important, some sepsis in the body. Some infection which has gone unnoticed, urinary tract infection, chest infection, boils, furuncle, tooth abscess, these are all common infections which can precipitate in a type 1 diabetic who is on insulin. The insulin requirement goes up in the infection. If you don't step up the dose of insulin during acute infections, then the patient can develop ketosis very rapidly, because the same amount of insulin is not adequate to control his sugar, and that's the reason this has to be prevented. If any person suddenly says that my blood sugar is going up and I'm getting a trace of urine ketones, many times we ask the patient to check the urine. They check it for sugar, but there is something known as ketodiastics. You dip the urine in those strips, the strips turn into a from pink to brown color, which shows that the patient is developing ketosis and passing ketones in the urine. That is a sign that you have to either step up the dose of insulin or admit the patient, give him intravenous saline, give him intravenous insulin requirement, remove the cause of ketosis. One of them is infection, infarction. Many patients of a cardiac abnormalities or a coronary artery disease, they develop what is known as silent myocardial infarction. Classical symptom of chest pain, palpitation, breathlessness is absent. And a patient, when you take a ECG in the emergency room, you see the patient has got hyperacute infarction. Infarction is one of the reasons why the patient can go into ketosis or ketoacidosis, because of the stress-related hormones. The stress hormones go up whenever there is a stress. Now, this stress can be a mild stress, like during examination, when the children are being stressed by the parents to stand first or get good marks, they are under tremendous stress. Their insulin requirement goes up. But if that doesn't happen, then they can develop ketosis. Stress is a very major event in a life of a diabetic patient, which topples the entire diabetes control, and that has to be tackled well by a good diabetologist. So friends, these are the three major complications that we see of acute metabolic complications of type 2 and type 1 diabetes. Now, these are many things which are variations. The patient can have simultaneous diabetic foot. A patient can have simultaneously pneumonias, acquired pneumonias. During COVID, we saw a lot of patients have multiple pulmonary manifestation, developed ketosis who never had ketosis in the past. because the pancreas is also damaged. Pancreatitis is another condition where the beta cells go on strike. They don't produce their own native insulin, and exogenous insulin is not adequately given. That is not sufficient. So, acute infections in the body of any type, whether viral origin, parasitic in origin, or bacterial origin, can precipitate this medical condition. So, that's about all in nutshell I want to talk, and this is what you should keep. Warning signals, don't ignore them, bring it to the notice of your doctor and immediately attend to them, otherwise you may land up in big problem. Thank you very much.